This is a recording of the Meet the Community Support Waiver, Understanding CDDO's Role from A to Z training presentation. This training will cover the following topics: Public Consulting Group's role with the Kansas Department for Aging and Disability Services in developing the Community Support Waiver, overview of the Community Support Waiver, eligibility, enrollment, and waiver capacity, person-centered planning, conflict-free case management, participant safeguards, services available on the Community Support Waiver, and self-direction. A second recorded training covers the role of CDDOs in helping applicants decide if the Community Support Waiver is a good fit for them. PCG's role. Public Consulting Group, PCG, is a public sector consulting firm that works with health, education, and human services agencies. The Kansas Department for Aging and Disability Services, KDADS, contracted with PCG to help write and organize the Community Support Waiver, CSW, design trainings for CDDOs, providers, and the public on key parts of the CSW, develop a plan for complying with federal conflict of interest requirements, collect feedback from stakeholders, and support contractors responsible for implementing the Community Support Waiver. Overview of the CSW. Kansas House Bill 2184 directed KDADS to develop a community support waiver with a per-person annual budget of $20,000. The CSW is designed for Kansans with intellectual and developmental disabilities, ages 5 and up, who do not need continuous 24-hour paid support. The CSW provides a range of services to help participants live more independent lives at home and in their communities, enhance natural supports and family caregiving, help people find competitive integrated employment, promote connection to the community, and increase opportunities for self-direction. Community Support Waiver Status. This presentation was recorded in June 2026. At this time, the Centers for Medicare and Medicaid Services, CMS, is currently reviewing the CSW application. This presentation covers content included in the CSW application. CMS must first approve the CSW before Kansas can implement the waiver. Content included in this presentation could change if CMS requires updates to the waiver application. KDADS will notify stakeholders of any substantive changes to the Community Support Waiver following CMS review. Eligibility criteria, enrollment processes, and waiver capacity. CSW eligibility criteria. The CSW has the same eligibility requirements as the IDD waiver. Participants must be 5 years of age or older, have an intellectual disability that began before age 18, or a developmental disability that began before age 22, be determined program eligible by KDADS, meet the Medicaid long-term care institutional threshold using the Medicaid Functional Eligibility Instrument, or MIFI, be determined financially eligible for Medicaid by KDHE, and be a resident of Kansas. Applicants do not have to demonstrate that their needs can be met within the $20,000 annual service limit. However, applicants and their families will need to understand that participants may have unmet service needs on the CSW if they join and have needs above $20,000. Waiver capacity. The CSW is capped at 500 participants. Waiver capacity may change depending on legislative appropriations and waiver enrollment and utilization data. The CSW does not have a waitlist. If the waiver reaches capacity, KDADS will not process applications until more spots become available. KDADS will communicate with CDDOs about waiver capacity. Reserved capacity. KDADS is holding reserved capacity on the CSW for the following groups. These spots can only be filled by individuals fitting the criteria for each category. As with overall waiver capacity, reserve capacity groups and spots may change depending on legislative appropriations and waiver enrollment and utilization data. 25 spots will be held for current IDD waiver participants. 20 spots for children in the custody of the Department of Children and Family Services who are living in a licensed foster care arrangement or in their home of reintegration. 2 spots for active duty or honorably discharged military personnel and or their immediate dependent family members. 2 spots for children determined to be no longer eligible for the technology-assisted waiver. 5 spots for participants determined to be no longer eligible for the brain injury waiver. 15 spots for children determined to be no longer eligible for the autism waiver. 5 spots for work program participants who were previously enrolled in either the CSW or the IDD waiver and who wish to transition or return to the CSW. 10 spots for CSW participants who experienced a temporary institutional stay in a hospital, ICF-IID, or nursing facility for fewer than 60 days, and 15 spots for individuals transitioning from applicable institutional settings, including psychiatric residential treatment facilities, into the community. Priority enrollment. Eligible applicants will get priority enrollment based on how long they have been on the IDD waiver waitlist. CSW applicants who are currently on the IDD waiver waitlist will receive priority enrollment. Applicants who have been on the waitlist the longest will be selected for waiver entrance before those who have been on the waitlist for less time or who are not currently on the waitlist. After priority applications have been processed, if there are remaining slots, applicants who are not on the IDD waiver waitlist will be offered enrollment on the CSW according to their date of application. Waiver enrollment. CDDOs help eligible waiver applicants make an informed choice about whether to enroll on the CSW. Individuals on the IDD waiver who want to transition to the CSW will not be able to automatically return to the IDD waiver if the CSW does not meet their needs. Individuals who want to return to the IDD waiver will need to use existing enrollment methods, the waitlist, reserve capacity, or crisis exception enrollment. Individuals on the IDD waiver waitlist who enroll in the CSW will lose their spot on the IDD waiver waitlist. The second training in this series, CSW Enrollment Counseling, Education, and Informed Consent, covers the requirements for CDDOs to educate waiver applicants and get their informed consent before waiver enrollment. The next section in this training covers person-centered planning. TCM qualifications and requirements. TCM agencies may not opt out of serving CSW participants. TCM agencies who serve IDD waiver participants must also serve participants on the CSW. If an agency is open to receiving referrals, they must accept referrals no matter which waiver the person is on. Additionally, KDAD's updated the TCM training requirements for the CSW. The state-designated case management training and assessment includes content on person-centered service planning, the HCBS settings final rule, restraints and restrictive interventions, and crisis prevention and intervention. Service plan development roles. TCMs develop participants' person-centered service plans, including backup plans, and MCO care coordinators review, approve, and authorize service plans. TCMs also develop behavior support plans for any participants who need them. MCO care coordinators fulfill the TCM's responsibilities for any participants who do not have a TCM. TCMs organize service planning meetings. Typically, the service planning meeting includes the participant's representative, if applicable, the MCO care coordinator, and current service providers, informal supports, or other individuals the participant wants present. During this meeting, MCO care coordinators will generally conduct the inter-RAI needs assessment, or they can arrange a time to conduct the inter-RAI before the service planning meeting. As a reminder, on the IDD waiver, participants have a person-centered service plan and a person-centered support plan. On the CSW, participants will not have a person-centered support plan. CSW participants will only have a person-centered service plan. Contact frequency requirements. TCMs must meet with participants by phone or virtually at least once a month, and face-to-face at least quarterly. MCO care coordinators must meet with participants at least once every 6 months. One of those required meetings is at their in-person attendance at the Person-Centered Service Plan Development meeting, which occurs every year a participant is on the waiver. Provider Options Counseling Rules. Provider options counseling is when CDDOs counsel participants on their provider options. This occurs at least annually, as well as whenever requested by the participant. Provider options counseling helps participants make an informed choice about the providers for their services outlined in their person-centered service plan. Once a participant has selected their providers, the TCM lists the providers in the service plan and collects signatures from the providers. The MCO Care Coordinator confirms the TCM has collected all signatures before authorizing the service plan. Conflict-free case management. Conflict of interest requirements. Federal conflict of interest requirements prohibit participants from receiving direct services from the same entity or agency that develops or monitors their person-centered service plan, unless no other providers are willing and qualified. The delivery of targeted case management and direct waiver services from the same entity or agency to the same participant is called conflicted service delivery. On the CSW, KDADS has developed a strategy for complying with these requirements. Participants are prohibited from receiving conflicted services unless no other providers are willing and qualified. CDDO conflict of interest responsibilities. CDDOs have several responsibilities related to these requirements, including applying for KDAD's approval on behalf of any affiliated providers who may need to deliver conflicted services, helping participants find non-conflicted providers for their services, and obtaining informed consent using a standardized consent form from participants who need to receive conflicted services when no non-conflicted providers are available. Participant safeguards. CSW participant safeguards. On the CSW, KDADS has increased protections for participants when it comes to restraints and restrictive interventions. This includes prohibitions on some types of restraints and restrictive interventions, updates to adverse incident reporting requirements, additional requirements surrounding behavior support plans and the role of behavior management committees, also known as human rights committees, and increased training requirements for some providers. Restrictive intervention definition. A restrictive intervention is any action or procedure that limits an individual's movement, access to other individuals, locations, or activities, or restricts participant rights. This does not include restraint or seclusion. This does include the use of aversive techniques that are designed to modify behavior. Commonly allowed restrictive interventions include restricting access to sharp objects, weapons, or other items that pose a serious threat to the health or safety of the participant or to others by the participant, and restricting access to food in circumstances in which access to food poses a serious threat to the participant's health or safety. Prohibited restrictive interventions. The following restrictive interventions are explicitly prohibited. Any interventions that cause pain or could result in tissue damage or injury, aversive conditioning, such as using unpleasant stimuli, including electrical aversion procedures, application of noxious taste, smell, or skin agents, application of water mist, etc., withholding basic needs such as food, water, sleep, exercise, visits, phone calls with family or professionals, and clothing, verbal abuse, threats, derogatory remarks, and humiliation, forced exercise and the assignment of hard or strenuous work beyond the capacity or typical functioning of the participant, deprivation of educational or employment services, and the use of police presence or emergency rooms as a principal strategy of behavioral support. Restraint and seclusion. The CSW prohibits the use of mechanical and physical restraint and seclusion. Chemical restraint is allowed. Chemical restraint may only be used if approved in the participant's service plan documents, including in their behavior support plan. Chemical restraint is defined as any medication provided with the intended purpose of altering a participant's behavior that is not part of the individual's routinely scheduled medication regimen. This does not include psychotropic medications that are used preemptively to manage anxiety, such as prior to a doctor's appointment. Providers must report all use of restraint and seclusion, authorized and unauthorized, via the Adverse Incident Reporting System. Adverse Incident Reporting Requirements. CDDOs now classifies the unauthorized use of restrictive interventions as an adverse incident, which must be reported via the Adverse Incident Reporting System. Unauthorized use is the use of any restrictive intervention not currently authorized in the participant's person-centered service plan. Providers do not need to submit an errors report if they used a restrictive intervention that is approved in the participant's service plan. As always, providers must report any uses of restraint or seclusion, including chemical restraints. Behavior support plans and behavior management committees. All restraints and restrictive interventions must be documented and approved in advance in the participant's behavior support plan. The behavior support plan is a component of the person-centered service plan. The TCM develops the behavior support plan for any participant who needs one. All waiver participants with a restraint or restrictive intervention in their service plan must have their behavior support plan reviewed and approved by a behavior management committee or a human rights committee at least annually. This includes participants who are under the age of 18, participants living independently, and participants self-directing their services. TCMs organize behavior management committees for any participant who needs one. TCMs can collaborate with other TCM agencies to establish joint behavior management committees. Required provider training. Waiver providers of some provider-managed services must complete an annual CDDOs-approved training covering restraint, restrictive interventions, crisis prevention, and crisis intervention. CDDOs must approve the training in advance in writing. Waiver providers of the following provider-managed services must fulfill this training requirement: behavior therapy, career exploration and planning, family caregiver support and training, individual employment support services, life skill services, personal care services, and respite. Required training content. At a minimum, this training must cover allowed and prohibited uses and types of restraint and restrictive intervention on the CSW, dignity of risk and the right of every person to make decisions, including decisions involving risk, methods of safely escorting participants, supervision of the participant while receiving chemical restraint, identifying the effects of chemical restraint, including signs of distress and the need for medical attention, physical safety during emergencies, proper use of positive behavior supports, techniques, and strategies to minimize and prevent the need for restraint or restrictive interventions, including de-escalation, conflict resolution, and active listening, and how to explain the use of restraints and restrictive interventions to participants, caregivers, and guardians. Required training exceptions. Provider agencies that prohibit the use of restraints do not have to provide this training on restraint. These agencies may submit their policy prohibiting restraint instead of providing this training. These agencies must still submit a training covering the other required topics. Waiver services. Annual service limit. The Kansas legislature established a $20,000 annual limit on services per participant. Only legislative action can adjust this limit. Exceptions to the limit are not allowed. All waiver services are limited to the participant's assessed need as identified in the person-centered service plan. Participants may have budgets below $20,000 depending on their assessed needs. Needs exceeding annual service limit. If a participant's needs cannot be met within the budget limit, the participant's TCM will help the individual prioritize which CSW services to receive and identify other non-waiver services and supports to supplement CSW services. If a participant's needs change such that the CSW is no longer a good fit for the individual, the TCM will refer the participant to another HCBS waiver program that can accommodate their needs. CSW services. This slide shows each of the services available on the CSW. On the following slides, we will discuss each of these services in more detail. Individual Employment Support, IES services. IES provides job-related support to help individuals maintain competitive, integrated employment, customized employment, or self-employment. Employment specialists collaborate with participants and their employers to provide guidance, coaching, and problem-solving strategies for long-term job success. The goal is to maximize the participant's potential, enhance their job satisfaction, and promote integration within the workplace. This service is based on the number of hours the participant works. This service has a different bill rate depending on how long the participant has worked in the job. Individual Employment Support Services provider requirements. IES may not be self-directed. This service can be delivered by individual employment support professional and agency employment support agency providers. IES providers must maintain industry certification in employment supports, such as through the Association for People Supporting Employment, APSES, Credentialed Employment Specialist Professional, the Association of Community Rehabilitation Educators, ACRES, Employment Services Basic or Professional Certification, or the ACRE Customized Employment Basic or Professional Certification. Providers must also complete an annual CDDOs approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention, and have training in the following areas and provide evidence of the current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Personal care services. PCS helps waiver participants accomplish tasks that they would normally do for themselves if they did not have a disability, including the following: activities of daily living, ADLs, such as bathing, dressing, toileting, transferring, ambulating, and eating; health maintenance activities, HMAs, such as ostomy care, catheter care, enteral nutrition, wound care, range of motion, reporting changes in condition, and medication administration; and instrumental activities of daily living, IADLs, such as meal preparation, shopping, medication monitoring, laundry and housekeeping, money management, communication, and transportation; assistance and accompaniment with exercise, socialization, and/or recreational activities; and assistance accessing medical care, including assisting during medical and therapeutic appointments. PCS can be provided to participants in their homes and in any community settings that comply with the HCBS settings final rule, including higher education settings and workplaces. PCS can also be delivered in a hospital setting to support participants with ADLs and IADLs. Personal care services provider requirements. PCS may be self-directed or provider managed and can be delivered by individual or home health agency providers. Provider-managed PCS providers must complete an annual CDDOs-approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention. All providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Respite. Respite provides temporary direct care and supervision for a participant because of the absence or need for relief of unpaid caregivers who normally provide care for the participant. Respite covers direct care and supervision for participants, including activities provided through personal care services, like help with ADLs and IADLs. Respite is provided in planned or emergency segments and may be delivered while the participant is awake or asleep. Respite on the CSW is not restricted to overnight use, and respite is billed hourly. Respite can be delivered in a participant's home, in the private residence of a relative, friend, or respite provider, in a licensed respite care home, in a licensed foster home, in a facility approved by CDDOs or KDHE, or in community settings. Respite provider requirements. Respite may be self-directed or provider managed, and it may be delivered by individual providers or agency providers, community mental health centers, or community service providers. Respite cannot be provided at the same time as personal care services, and respite may not be provided by the parent of the participant if the participant is a minor child. Provider-managed respite providers must complete an annual CDDOs-approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention. All providers must have training in the following areas and provide evidence of current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Behavior therapy. Behavior therapy uses research-based strategies to help people change to improve their quality of life and reduce challenging behaviors like aggression, destruction, self-injury, and/or poor anger management. Together with a therapist, participants work on positive changes to themselves and their environment to improve their self-control, coping skills, and level of independence. Behavior therapy may involve the use of behavioral assessments and/or the development of behavior intervention plans. Behavior intervention plans can focus on workplace behavior management, crisis management, behavior reduction, and skill acquisition. Participants can choose to receive behavior therapy services in person or virtually. Behavior therapy provider requirements. Behavior therapy cannot be self-directed. Behavior therapy may be provided by registered behavior technicians, behavior therapy providers, licensed psychologists, certified behavior analysts, and licensed social workers, as well as by home health agencies. Providers must complete an annual CDDOs approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention, and have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Occupational therapy. Occupational therapy helps participants achieve greater independence by gaining and retaining the physical, perceptual, and/or cognitive skills needed to perform activities of daily living. Occupational therapy also includes helping participants change their environments or find adaptive equipment or supplies. Occupational therapy provider requirements. Occupational therapy cannot be self-directed. Occupational therapy can be delivered by occupational therapists or by home health agency providers. Occupational therapy can be provided at a participant's home or at the provider's place of business. All providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Physical therapy. Physical therapy helps individuals with their motor functioning and mobility. Participants receive treatment to help them move and perform functional activities in their daily life, prevent mobility loss, and achieve a healthy and active lifestyle. Treatment may involve intensive work in many areas, including standing, sitting, walking and balancing, increasing muscle tone, endurance, strength, and coordination. Physical therapy provider requirements. Physical therapy cannot be self-directed. Physical therapy can be delivered by individual physical therapist providers or by home health agencies. Physical therapy can be provided at the participant's home or at the provider's place of business. All providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Speech and language therapy. Speech and language therapy treats speech and/or language disorders, including problems with producing sounds and understanding or putting words together to communicate ideas, as well as issues related to swallowing and respiration. Speech and language therapy cannot be self-directed, and it can be provided by speech-language pathologists or by home health agency providers. Speech and language therapy can be provided at the participant's home or at the provider's place of business. All providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Assistive technology. Assistive technology is an item, piece of equipment, or product system used to maintain or improve a participant's functional capabilities, independence, and/or vocational skills. This service includes the following: consultation, evaluating what assistive technology a participant might need; equipment, covering the cost of leasing, buying, or customizing equipment to meet a participant's specific needs; installation, installing, servicing, or repairing the equipment, and support, training for the participant, caregiver, and/or employer to understand how to use the technology. MCOs request bids for assistive technology services and will select the most economical option available to meet the participants' assessed needs. MCOs will not accept bids solely based on the cost proposed. This service cannot be self-directed. Benefits planning helps participants understand how promotion, higher wages, increased hours, or other work changes could impact their public benefits. Certified benefits planners help participants verify their benefits and plan for the future, develop plans for achieving self-sufficiency and property essential to self-support, coordinate work incentives across multiple benefit programs, and report their income for public benefit programs, including to the Social Security Administration. Participants can use benefits planning if they are considering an employment opportunity or job change, seeking career advancement, or need help solving financial problems to maintain benefit eligibility and employment. Benefits planning requirements. Benefits planning cannot be self-directed. Benefits planning can be provided by individual, certified benefits planners, or by agency, benefits planning agency providers. Benefits planning can be provided in person or virtually. Career exploration and planning. Career exploration and planning helps participants obtain or advance in competitive integrated employment or self-employment. This service includes the following: job exploration, helping participants explore potential career paths, understand industry requirements, and assess their skills and interests. Job search, helping participants identify job openings. Resume management, helping participants create effective resumes, tailor them to specific job applications, and manage professional documents. Job applications, helping participants throughout the job application process, including completing applications, following up, and negotiating offers. Interview preparation and support, providing practice interviews, coaching on interview techniques, and offering advice on answering common interview questions. And community outreach, facilitating outreach to potential employers through calls, networking events, or industry connections. Career exploration and planning provider requirements. This service cannot be self-directed. It can be delivered by employment support professionals or employment support agencies, and it may be provided one-on-one or in a group, at a participant's residence, the provider's place of business, or in a community setting, and it may be provided virtually or in person. Providers must maintain industry certification in employment supports, such as through the Association for People Supporting Employment, APSE, Credentialed Employment Specialist Professional, CESP, the Association of Community Rehabilitation Educators, ACRE, Employment Services Basic or Professional Certification, or the ACRE Customized Employment Basic or Professional Certification. Providers must also complete an annual CDDOs approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention, and have training in the following areas and provide evidence of a current certificate of completion for abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Family caregiver support and training. Family caregiver support and training is delivered to family members or caregivers who provide unpaid support, companionship, or supervision to participants. This service may not be used to train paid caregivers. This service includes support and training on the following: how to provide a safe and supportive environment for participants, healthy coping strategies to decrease caregiver strain, improve relationships with others, and increase social support, understanding and addressing the participant's specific needs and their person-centered service plan, problem-solving skills, coping mechanisms, and strategies for the participant's symptoms and behavior management, understanding the waiver process, and help finding supportive resources in the community. Family caregiver support and training provider requirements. This service must be directly related to the unpaid caregiver's role and intended to achieve goals identified in the participant's person-centered service plan. This service can be self-directed or provider managed, can be provided individually or in a group setting, and can be delivered virtually or in person. It can be delivered by a family caregiver support peer provider, a licensed mental health professional, or a center for independent living, community service provider, or community mental health center. All providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Agency providers and licensed mental health professional providers must also complete an annual KDADS-approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention. Home and environmental modification services. Home and environmental modification services provide physical modifications to a participant's home to give the participant greater independence and create a safer, healthier environment. Allowed modifications are based on an assessment of the participant's needs. This service includes the following: modifications to the participant's home, training to use the modification, and repairs or maintenance of the modification. MCOs request bids for home and environmental modification services and will select the most economical option available to meet the participant's assessed needs. MCOs will not accept bids solely based on the cost proposed. This service cannot be self-directed. Home telehealth. Home telehealth provides remote monitoring systems to help participants manage one or more diseases and catch early signs of trouble so intervention can occur before the participant's health declines. This service includes participant education on one or more diseases and nursing supervision. It automates disease management activities. It engages participants with personalized interactions and education to improve their self-management, and reduces healthcare costs by helping the participant meet goals for diet, exercise, medication, treatment, and monitoring of conditions. Home telehealth is only available to participants who have had 2 or more hospitalizations or ER visits within the past year, or who are transitioning from a nursing facility back into the community. Examples of home telehealth systems include cardiac monitoring systems, vital sign monitoring systems, and vital sign telemonitoring mattresses. Home telehealth provider requirements. Home telehealth cannot be self-directed. This service can be delivered by home health agencies and county health departments. Providers of this service must have training in the following areas and provide evidence of a current certificate of completion from an accredited source: abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Providers must have equipment to monitor a participant's vital signs daily, such as heart rate, blood pressure, mean arterial pressure, weight, oxygen saturation, and temperature, and that is capable of asking the participants questions. And providers must be able to communicate in the participant's chosen language. Individual Directed Goods and Services, IDGS. IDGS allows participants to use their self-directed budget to purchase services, equipment, and supplies that cannot be obtained through any other CSW service or through the Medicaid state plan, and that address a specific identified need. IDGS requirements. IDGS is only available via self-direction. The FMS entity is responsible for purchasing IDGS authorized in the participant's person-centered service plan. IDGS is approved on a case-by-case basis, but must meet the following criteria: the item or service decreases the need for other Medicaid services, promotes inclusion in the community, or increases the participant's safety at home. The participant cannot afford to buy the item or service, and it is not available through another source. The item or service advances the participant's goals listed in their person-centered service plan. The item or service is not experimental or prohibited by federal and state law. The item or service is acquired in the most cost-effective way, be that rental, lease, or purchase. The item or service can fit in the participant-directed budget without affecting participant health or safety. And the item or service is only for the benefit of the participant. Life skill services. Life skill services help participants develop the practical, social, and emotional skills necessary for successful independent living, including communication, effective communication skills for self-advocacy, active listening, and public speaking, including adaptive and assistive technology supported communication, personal development, effective interpersonal skills, intimate relationship management, anger management, stress management, conflict resolution, and self-esteem, problem solving and time management, identifying and addressing challenges, thinking critically, making informed decisions, prioritization, goal tracking, and organizing personal tasks. Adaptability, flexibility, resilience, and the ability to adjust to change. Technical skills, proficiency in relevant computer software tools and technology. Financial management, money management, credit building, bill payment, and saving. Independent living skills, personal property ownership, housing, living with roommates, managing utilities, instruction in cooking, cleaning, and home maintenance, and obtaining a driver's license. Health and wellness, navigating the healthcare system, scheduling medical appointments, personal hygiene, nutrition, exercise, and mental health awareness, and transition and future planning, supporting participants in making successful transitions throughout their lives. Life skill services provider requirements. This service cannot be self-directed. This service can be provided one-on-one or in a group, at a provider's place of business, in a participant's home, or in the community, and may be delivered virtually or in person. This service can be provided by life skills peer providers, centers for independent living, and community service providers. Providers must complete an annual CDDOs approved training that covers restraint, restrictive interventions, crisis prevention, and crisis intervention, and have training in the following areas and provide evidence of a current certificate of completion from an accredited source. Abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Medication reminder services. Medication reminder services provides a scheduled reminder to a participant when it is time to take medications. This service may include a phone call, recording, alarm, or dispenser, depending on the specific system and the participant's needs. This service includes rental and installation of the medication reminder dispenser and education on using the device. This service cannot be self-directed. It may only be provided by medication reminder services providers. Providers must have training in the following areas and provide evidence of a current certificate of completion from an accredited source. Abuse, neglect, and exploitation, including state law reporting requirements and prevention, CPR, and basic first aid. Non-medical transportation, or NMT. NMT enables participants to access waiver or other community services, activities, and resources in a participant's person-centered service plan. NMT may include the purchase of public transit tickets or passes, but NMT does not include training on how to navigate public transportation. NMT may be self-directed or provider managed and can be delivered by a driver or by a contracted transportation agency. Contracted transportation agency providers must adhere to the same requirements as NEMT providers. NMT is only reimbursable when transportation is not available through another waiver service or Medicaid state plan service. Personal Emergency Response Systems, PERS. Personal Emergency Response Systems are electronic devices that signal a response center when activated so participants can get help in an emergency. This service covers equipment rental. Maintenance of rental equipment is the responsibility of the provider. PERS may only be provided by personal emergency response system providers. PERS may not be self-directed. PERS is similar to the medical alert rental service on the IDD waiver. PERS requires that the device have backup batteries or other backup power sources, that the participant can turn off or unplug the system, and the PERS provider must receive permission to use the device in the home. Remote support services. Remote support services uses technology such as two-way communication devices, sensors, GPS tracking, and webcams to provide monitoring and help from another location in place of physical staff presence. Remote support services allows participants to communicate on demand with provider staff to respond to needs remotely. Providers work with participants to develop a plan of care, design remote monitoring based on the participant's service plan, and identify individuals who the provider should contact if the participant needs in-person support. This service cannot be self-directed and may only be delivered by agency remote support services providers. Remote services can be provided in a participant's home or in community settings. Specialized medical equipment and supplies. Specialized medical equipment and supplies cover items that provide a direct medical benefit or remedy to the participant, including devices, controls, software, and/or appliances to help participants perform activities of daily living, items and associated supplies and equipment necessary for life support or to address physical conditions, and durable and non-durable medical equipment not available through other Medicaid services. Specialized medical equipment and supplies covers the maintenance and upkeep of devices, including normal wear and tear, and training on how to use the devices. This service cannot be self-directed. Vehicle Modification Services, or VMS. Vehicle Modification Services adapts a vehicle to the participant's safety needs and removes barriers to transportation. It must be the participant's primary means of transportation. VMS includes the following: assessment to determine what a participant needs as a driver or passenger, the purchase of parts or services needed to modify a car owned by the participant, a parent of a minor, or another unpaid primary caretaker, repairs to a modification on a vehicle, and training on the use of the modification. Vehicle Modification Services requirements and prohibitions. The vehicle must be owned by one of the following: the participant, a family member with whom the individual lives or has consistent and ongoing contact, or a non-relative who provides primary long-term support and is not a paid provider of such services. MCOs request bids for vehicle modification services and will select the most economical option available to meet the participant's assessed needs. MCOs will not accept bids solely based on the cost proposed. This service cannot be self-directed. Vehicle modification services cannot be used to purchase or lease vehicles, cover the cost of general vehicle maintenance or repair, cover the cost of state inspections, insurance, fines, or tickets, or to purchase adaptations that do not directly benefit the individual. Virtual Delivery of Services, VDS. The following services can be provided virtually or in person and are subject to KDAD's Virtual Delivery of Services policy: individual employment support services, personal care services, behavior therapy, benefits planning services, career exploration and planning, family caregiver support and training, and life skill services. Per the KDAD's VDS policy, VDS must be agreed to by the participant in the service plan. The participant must have an informed choice between in-person and virtual service delivery. VDS may not be the only service delivery option offered to the participant, and VDS cannot be used for the provider's convenience. Provider affiliation requirements. The following providers must affiliate with the CDDO operating in the catchment area where the participant lives. For behavior therapy, licensed social workers, licensed psychologists, certified behavior analysts, registered behavior technicians, behavior therapy providers, and home health agencies. For benefits planning, certified benefits planners and benefits planning agencies. For career exploration and planning, employment support agencies and employment support professionals. For family caregiver support and training, community service providers, community mental health centers, centers for independent living, and licensed mental health professionals. Please note that family caregiver support and training peer providers do not need to affiliate with the CDDO. Provider affiliation requirements, slide 2 of 3. The following providers must also affiliate with the CDDO operating in the catchment area where the participant lives: for home telehealth, home health agencies and county health departments; for individual employment support services, employment support agencies, and employment support professionals; for life skill services, community service providers, centers for independent living, and life skills peer providers; for medication reminder services, medication reminder services providers; and for non-medical transportation, contracted transportation agencies. Please note that individual drivers do not need to affiliate with the CDDO. And for occupational therapy, occupational therapists, and home health agencies. Provider affiliation requirements, 3 of 3. The following providers must also affiliate with the CDDO operating in the catchment area where the participant lives: personal care services, home health agencies. Please note that personal care service individual workers do not need to affiliate with the CDDO. For personal emergency response services, PERS providers. For physical therapy, physical therapists, and home health agencies. For remote support services providers. For respite, community service providers, community mental health centers. Please note that individual respite providers do not have to affiliate with the CDDO. And for speech and language therapy, speech and language pathologists, and home health agencies. Self-direction. The CSW allows participants to self-direct the following services: personal care services, respite, non-medical transportation, family caregiver support and training, and individual directed goods and services. Participant responsibilities. Participants who choose to self-direct personal care services, respite, non-medical transportation, and/or family caregiver support and training must do the following: recruit, hire, schedule, supervise, and train workers, verify qualifications, and if desired, set extra qualifications above state minimums, set staff wages within the approved rate range as applicable, obtain criminal history or background checks, determine staff duties consistent with service specifications, approve timesheets, and replace and fire workers when needed. Participant responsibilities, staff wages. On the CSW, participants can select staff wages within the state's established rate range for personal care services, respite, and family/caregiver support and training. There is no rate range for non-medical transportation, and participants must pay providers the self-directed rate established by the state. Updates to the CSW. The CSW states that participants who self-direct services receive additional support from the Financial Management Services (FMS) entity, including a support broker. CDDOs does not have funding for support brokers and is working with CMS to determine how to revise the waiver. Participant supports for self-direction, slide 1 of 2. The TCM will help self-directing participants with the responsibilities that had been identified for support brokers, including understanding the responsibilities and risks of self-direction, recruiting, hiring, and training staff, developing backup staffing plans, determining staff wages and managing their self-directed budget, including IDGS purchases, and helping participants develop a monthly spending plan that documents staff wages, scheduled services, and IDGS purchases. TCMs also review monthly spending plans to ensure they align with the participant's person-centered service plan. Participant supports for self-direction, slide 2 of 2. When a participant hires a worker to deliver a self-directed service, the FMS agency helps the participant verify background checks and minimum provider qualifications, complete timesheets and payroll and process invoices, withhold and file required taxes and maintain workers' compensation, and provide reports on a participant's budget and service spending. The FMS agency will also host an online portal showing participants' budget and spending. The FMS agency, along with the participant's TCM and MCO care coordinator, monitors a participant's self-directed budget and helps the participant address underspending, overuse or extra hours, uneven use of service hours, and high worker turnover. This concludes our presentation. Thank you for listening. If you want to reach out or have any questions, you can email the Kansas Department for Aging and Disability Services at kdads.csw@ks.gov. Thank you.